Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Pathology of Graves' disease. So, a patient with actually this Graves' disease is an autoimmune process. Because it is an autoimmune process, there are some triggers or risk factors. Though it is an autoimmune process, it has some triggers also. Okay, what are the risk factors or triggers? So, what are they? So, risk factors or triggers include the postpartum state. It can occur due to the postpartum state, or iodine excess can uh, activate Graves' disease, or it can be due to lithium therapy, or even some bacterial and viral infections can trigger the Graves' disease. It is an autoimmune process where you see presence of antibodies, and these antibodies are seen, and this actually Graves' disease is also associated with HLA antigens also. So Graves' disease is associated with HLA-B8, HLA-DR3, HLA-DQ0 510 and CTLA4, and especially HLA DRB071. This is protective against the Graves' disease. So this HLA DRB071 is protective against Graves' disease. Then actually, in the Graves' disease, there is presence of thyroid stimulating hormones are present. These thyroid stimulating antibodies are present. These thyroid stimulating antibodies will stimulate the thyrocytes, and when they stimulate the thyrocytes, these will grow, and they will also synthesize the thyroid hormones. Because of increased thyroid cells, they produce thyroid hormones, thus resulting in thyrotoxicosis or hyperthyroidism, which is nothing but the Graves' disease. This Graves' disease is an autoimmune disorder. Because Graves' disease is an autoimmune disorder, it is associated with other autoimmune conditions. Like it is associated with type 1 diabetes mellitus. So, Graves' disease is associated with type 1 diabetes mellitus, Addison's disease, pernicious anemia, and it is also associated with myasthenia gravis. Next, histopathology of the Graves' disease. In histopathology, if you do a biopsy or mm, if you do a histopathological examination of the Graves' disease, you will see that there is a hyperplastic gland is present with an increased production of cells, and there is columnar epithelium is seen with minimal colloid. So there is a hyperplastic gland with columnar epithelium and minimal colloid is seen. And nuclei may show mitosis is seen in the Graves' disease. And you can also see that in the hyperplastic glands, in the hyperplastic epithelium, there is papillary projections are seen. So in Graves' disease, you will see that there are many papillary projections are seen, and these papillary projected glands have a lots of high to low columnar epithelium is seen, which is seen in several layers of high to low columnar epithelium is seen, and there is just a minimal colloid is seen in these conditions. So this is the histopathology of Graves' disease.
thank you and thank you for watching.